Okay, so what we're gonna do here is we're gonna talk about tendency of collapse and then how to kind of course correct a bit using our navigation tools through our 3 planes of motion. So we have the S plane here line that follows the S curve of the spine, okay? We have our T plane, which is transverse, which is our twist plane for rotation of both the spine and especially the thoracic here, and at the hips, not the pelvis kind of moves with that lower portion here, and then the hips is more like knee sway. Okay, see how my feet are planted and I'm kind of, my knee kind of comes in and down, not, this would be the final plane. It's hard on the seat here because it's a saddle seat, but imagine the other plane is the F plane, which is in line with the seam of your pants and shirt. So the F plane would be if I actually slide like in and out, like jumping jacks or snow angel kind of motion. But if I kind of imagine this twist, right, versus this in out, or it's easier to follow with a straight leg there, kind of that in out, straight in out versus a twisting turning. You can see my foot turn in, turn out. Okay, so we're going to combine those things to help with posture and seated, and then I'll demonstrate in standing, even though I don't have an actual wall. I'll demonstrate against the curtain here so you can kind of imagine as if there was a wall. So the first thing is we want to think about those lower ribs. We want to anchor those back, engage that core, stretch up tall, take out a lot of slack here. Try to get a sense of everything being square and straight, so the knees are coming straight out from the hips here a little bit, maybe slightly out, but not too much, especially if it's one side that is usually the side that's actually collapsing. So we want to be here, feet kind of grounded, okay, chest, my button up and forward over my belt buckle so I can feel a little bit of weight in my feet, not a ton, but enough to feel like I can control and leverage things. Okay, so in thinking about primarily the pelvis here, this will give you a good sense of that navigation. So again, like if you divide the torso, the body into like 3 sections here, imagine like a snowman or snow person here. So like my head is actually giant head that comes down. For women, this is about where the bra line is. So that's the whole like top third, okay? Then we have the lower ribs down through the pelvis, basically down to the hip joint is where you're gonna have that next dividing line. And so that's your middle section from the bra line down to the hip joints, okay? And then you have basically your legs, all right? And that's controlled through the hip. Okay, so again, we can rotate and we can slide, glide, like in, out. There's a forward, backward there, but it's not gonna be very adaptable because my seat's gonna be in the way here. I mean, I could march and go this way if I wanted. So what we're gonna do is we're gonna combine those things and kind of navigate and align things better. So using the pelvis as my tactile cueing here. So generally the collapse goes like this on the weak side, say my left side here. So if I imagine my knees as like pistons, usually that one's gonna be out longer, forward, which is gonna pull the pelvis out and kind of relatively forward. But what it actually is a twist to my strong side, which makes sense because usually you're gonna, almost like a skier, kind of navigating, slaloming kind of back and forth, steering over to the right, which is the stronger side. The leg isn't necessarily out, because what happens is as I accommodate the load, the leg actually pulls back to get me into my glute to better support my body weight because it's stronger back there. So that pretty much happens automatically on the stronger side usually, or at least does a better job than the weak side. So what I want to be sure of is that I balance that out, and this side to side is going to be kind of through that F plane. So that's like where my hip is actually up, forward, and my leg is kind of out, forward, longer, almost like you'd be on the right side when you're working a pedal, gas or brake in a vehicle, okay? So watch out for that tight scrunch, pinch, pain, right? So we wanna make sure our weight is shifted and balanced in the middle. And to do that on the weaker side, you usually have to pull back, which is a twist, T-plane, pull back, right? And I'm twisting my midsection back in relative. I don't want my hip to go out. My lower part is actually going to turn relatively in to keep the knee straight, and that's where you might feel some tightness in through here, and like you might have to work those inner thigh muscles to pull it in a little more there, right? And you might feel like that's a little uncomfortable, okay? But you want to make sure you can really get back. You're trying to steer, connect back from your core to your glute, their guts to butts, to get back in that hip and maybe lean forward a little bit with your chest, because that's also going forward. The middle's going back, top and bottom third are actually relatively turning in against that to create a twist on those seams, middle, back, bottom, and top, forward, or twisting to the opposite side, okay, so here. And then once there, because now I can connect to my glute, because my weight's forward my chest, I can push down and I can engage the muscles on the side here to hike the hip on this right so that I'm not weights over there. See, I want to lift that up and level that off. So I twist and engage to the sagittal plane, my glute, and then I engage the frontal plane, the gluteus medius here, to lift and hike to level the pelvis that way. And then I'm stretching tall on top. So, okay, so same thing when we're standing against the wall, all right? So I'm gonna say, gotta anchor back here, the lower ribs, anchor kind of, doesn't have to touch the wall, but anchor back. And again, where's my weight? Am I over on my right? I gotta shift over here, and as I do that, I'm gonna twist, pull back to the glute, down to the floor, and then engage that lateral muscle, the gluteus medius, to hike and level the pelvis. So that's exaggerated, that's a full weight shift, and I can feel that back and forth. But what I really want for standing posture is finding neutral in all those three planes, lifting tall and level and stable, and that's where we should be.